want to welcome Alexander and the members of Virginia Organizing and other supporters who have come to welcome the mayor of Belhaven, North Carolina, who has been walking, and he can tell you how many steps he's made, but we are welcoming him because he's going all the way to Washington, D.C., and we certainly want to thank him for the commitment that he has to this event and this issue, so that they might know of that commitment in D.C. and along the way where he has stopped to help others to see the issue in its clearest perspective and to let them know of his commitment. On behalf of the citizens of Fredericksburg and this entire greater Fredericksburg area, we want to welcome you today and to say to you we're grateful for your commitment, and our presence here is a demonstration of our commitment and our support for all that you're doing. With that, I want to give you an opportunity to say hello to us. All right.
I'd like to thank all of you for coming out today. Bob Zellner right here, a civil rights legend. This is Martin Luther King, Rosa Parks' protege. Used to work with him in civil rights. He's an Alabama boy who worked civil rights back in the 60s. So he's been almost hung, shot, and everything else. But anyway, Bob has been with me the whole way and has made 90% of the steps. He's 75 years old. It's been spectacular.
I can keep up with the Iron Man.
We're alike in some ways and not alike in some other ways. And Bob, about the second day, I said, "Well, you're just a flaming liberal." He said, "No, I'm a radical."
Go to the root of the matter.
So anyway, Bob and I had some phenomenal discussion. I think we both learned something. The reason that we're making these 540,000 steps is because in our country right now there's a problem, and it's the rural hospitals are starting to struggle, starting to have a very difficult time making it. One of the items is the Medicaid expansion. When you have these small hospitals that are struggling to survive, that are barely breaking even every year, when you take revenues away from them, it hurts them. With Medicaid expansion, what happens is this new Affordable Care Act, Medicaid expansion comes in, but indigent care reimbursements start falling at the hospitals. So the states that aren't taking aren't taking Medicaid expansion, indigent care reimbursements, revenues are falling, and instead of it being offset with Medicaid expansion, that's not happening. So you actually have a double whammy that's actually causing these hospitals a lot of problems. For example, critical access hospitals, 40% of critical access hospitals don't make money. The reason they're called critical access is because the government years ago designated them that because of the geographic location of some of these hospitals due to the people, the dispersion of people, they needed some health care. So years ago the government made sure health care got in certain spots to make sure people had adequate emergency care. Well, what you have today is you have these big conglomerates coming in, taking advantage of the shortfalls and revenues of these hospitals, starting to buy out the smaller hospitals, and they close them. Well, every time they close a hospital, it means somebody just got farther away from emergency room services. In our town, we had a healthcare conglomerate named Vidant Health. The community reached out to them because our hospital was losing some money. We reached out to them because they were a big conglomerate close by. It's where all the heart surgery, cancer treatments, all the big money things is where they were. And the community turned over our hospital to them. The assets were $1 million more than the liabilities. Just give it to them. They didn't buy our hospital. They took it over. They took it over in a contract promising to maintain and strengthen our hospital. That was September of 2011. September 2013, I got a phone call from a TV reporter that said, "Mayor, you want to give us a comment on your hospital closing?" I had no thing about it. So they decided to close our hospital. Well, I called a rally a few days later after the Vidant wouldn't talk to me. We had a rally of about 300 people. then Vidant would talk to me. I went out, they basically told me what they were going to do. They didn't negotiate, didn't want to talk about what they were going to do. They were just dictating us what they were going to do. So we ended up going through a process of some very difficult times. Finally, the NAACP, who was with us pretty much from the beginning, they lodged a Title VI complaint against Vidant with the Justice Department, with Health and Human Services, the Office of Civil Rights down in Atlanta, and we started a process of trying to get our hospital back. The story goes a little quicker as I go, but anyway, we had a situation where we ended up going to mediation with Vidant. That was sponsored by the Justice Department. They sent a federal mediator down to look at our situation. We then came to a mediation agreement that all parties signed that extended the hospital closure 3 months to give the community time to bring the hospital back. And then that big healthcare conglomerate spent the next 3 months jerking us around. They all of a sudden decided the assets of the hospital didn't include cash on hand, accounts receivables, computer software, patient information systems. They pledged $1 million July 1st when we took the hospital back. Then they put a bunch of stipulations on that weren't there when we signed the agreement. They held documents for up to 2 weeks we have proof of. When we did get information, they did data dumps that you couldn't figure out what they did. So they played all these dirty tricks and games with us, trying to keep us from getting back our hospital. Because what they wanted to do was shut our hospital, and they knew it was force everybody to go to their next hospital down the road. So they could get rid of the expenses of running our hospital, send all the people down the road, and make more money. So even though, now listen to this nonprofit made $127 million in 2012. This nonprofit made $109 million in 2013. This nonprofit has $550 million in the bank. And they closed our critical access hospital. And I'm upset.
Yeah. And the hospital lost less money to the state.
The hospital lost $1.2 million in 2013 due to their horrible management. They sent a manager to our hospital a half a day a week. Now imagine running a hospital with the boss coming in a half a day a week. That's not going to work too well. It's like it was systematic obsolescence is what they were doing. We also have a very strong suspicion they were transferring expenses to our hospital in the books to make it look as bad as they could to justify them closing it. They played every dirty game you could play. Their CEO of Vidant Health makes more than twice what our hospital lost a year. So one man's compensation is twice what our hospital lost in a year, and they took emergency room services away from over 20,000 people. Now I'm walking to Washington, D.C. because I think somebody in Washington, D.C. possibly is going to have a position of power and look at this situation and say, that's not America. We're not going to have that. Those 20,000 people, do 20,000 people mean more than one? Do 20,000 people's emergency care, is it worth more than one man's salary? Half of one man's salary? Listen to this. A nonprofit CEO, half of his salary is more than what our hospital lost. And he looks at me and tells me, just lose too much money, we got to close that hospital. Now that's wrong.
And it charges his whole salary to that one.
So now what we're trying to do.
I'm sorry.
So now what we're trying to do.
Another speech.
What we're trying to do now is we're trying to walk to Washington, D.C., bring attention to this, explain how important Medicaid expansion is to these rural hospitals all over the country. Let people know that these rural hospitals are under attack because the big conglomerates are taking advantage of their financial woes, especially with this not accepted places where Medicaid expansion is not taking place. We want to ask the Health and Human Services Secretary to have to sign off on any critical access hospital being closed. A private entity, even a non-profit entity, who's supposed to be for the public good, no private entity should be able to come in and shut down health care to 20,000 people and the government have no say about it. That's wrong. We also need that if they are going to let a critical access hospital close, we need a 1-year notice for communities so they can take back their hospital, so they can have time to have ideas and figure out how to save their hospital. Because our hospital, we had a $30,000 business plan paid for by the town to see if our hospital was feasible. So I'm not up here being unrealistic and saying we've got a hospital that's going to lose a couple $1 million a year into the future. Well, that would be unsustainable. We had a business plan done that actually shows our hospital can be profitable. That shows with the Affordable Care Act provision that allows the formation of an accountable care organization with an ACO tied into our hospital. We've got a conservative business plan that shows in 2 years it can make about $50,000, in 3 years it can make $500,000 and up. So this big conglomerate is closing down a hospital that we have a business plan that shows it can succeed, but they don't want it to succeed because they can't make enough money off of it. They make more money if they close it and force people to Washington. And guess what? Those poor people that can't pay, they have a hard time getting to Washington, so that's going to deter that, which means people get sicker. So we've got an immoral, and I say that with no reservation whatsoever, I'll stand on top of that building over there, an immoral, greedy nonprofit that is destroying our health care. And our community is based on retirees coming down. People just like y'all come down to Belhaven to retire because it's beautiful, it's all water. Okay, well, are you going to a community that doesn't have a hospital and you're a retiree? No. So not only are they killing our health care, they're ripping our heart out for the future of our town. So I had to get on my oboes. I've never heard the shoe. O-B-O-Z. Never heard of them, but they're good. And walk to Washington, D.C. to try and get information out of folks and let everybody know what's going on in this country. We got to stop this from going on. Now,